Rub a teaspoon of extra virgin olive oil on this exact spot for 60 seconds, and within days, many men over 60 report firmer, quicker erections. Would 60 seconds change years of slow mornings and weak nights? If you're tired of excuses and quiet disappointment, this is the simplest thing you can try tonight. I'm not selling a pill. I'll show you a safe, doctor-friendly technique backed by simple science. This function is often the canary in the coal mine for men's health. A change in erections can be an early signal of vascular or hormonal trouble in men over 60. Ignore it, and it's not just performance that suffers. Poorer erections can mean poorer blood flow, faster tissue aging, and lower testosterone activity. They can also be linked to heart risk or worsening prostate symptoms. Urologists and cardiologists often connect erectile changes with overall vascular health. If you brush this off, you may miss a chance to address bigger problems early. And beyond the body, the effects are emotional. Confidence slips, intimacy strains, quiet embarrassment grows. You probably expected a pill or a gym plan. Here's the twist. The single best first step is a 60-second oil massage. Not invasive, not expensive, just a minute. I'll show you exactly where to rub, how to warm the oil, and how to do it safely with your doctor's blessing. I'll also share real examples of men who tracked small improvements in weeks. Why does this work? Start with a simple idea. Local blood flow is king. An erection is a local blood flow event. Blood must rush into tiny chambers and stay there. If the small vessels don't open well, nothing else matters. You can't fix everything with a pill if the plumbing is stiff and cold, but you can nudge the local system. Gentle massage and warmth tell tiny vessels to relax. That helps the lining cells produce more nitric oxide. Nitric oxide is the body's natural vasodilator. It's the same chemical many ED treatments aim to support. But here, you trigger it naturally with touch and heat. Why extra virgin olive oil? Use one oil and one oil only. Extra virgin olive oil is gentle on older skin. It contains mild antioxidants and anti-inflammatory components. It helps the skin glide without irritation. It's widely available and safe for daily use for most men. It's not magic. It's a skin conditioner plus mild chemical support that helps the massage feel better and last longer. Quick safety note: don't use it with latex condoms. If your skin is sensitive, do a small patch test first. Why 60 seconds? And why those exact spots? 60 seconds is long enough to warm tissue. It raises local blood flow without causing irritation. You target the perineum, the small area between the scrotum and the anus and the base of the penis. Those spots sit over the pelvic vessels and nerves that feed erection function. You don't have to rub the shaft for minutes to get benefit. The change starts under the surface. Short, focused, daily is the trick. How should you move? Gentle pressure, circular motion, paired with breath. Think slow, soft circles. Light pressure, not rough, not racing. Start with clockwise circles, then go counterclockwise. Breathe with each motion. Inhale slow, exhale longer. The breath helps the nervous system relax. When the nervous system eases, blood flow responds. The simple science behind this is straightforward. Warmth and touch dilate vessels. Dilation improves local blood supply. That supports tissue health and nerve signaling. Small studies and pelvic floor rehab reports suggest targeted stimulation increases blood flow and helps recovery after surgery. Clinicians in pelvic health clinics use similar local techniques to speed nerve recovery and reduce numbness. So this is not a wild claim. It's a practical nudge that fits with what pelvic specialists already do. Safety matters. This is low risk, but not zero risk. Wash your hands first. Use a clean teaspoon. Warm the oil in your palms. Not hot, just warm. Use a small amount. Stop if you feel pain, burning, or a new redness. Do not use if you have open sores or active infection in the area. If you are on nitrates, have unstable heart disease, or had recent prostate surgery, check with your doctor first. This is a habit you can try, but it is not a substitute for medical care. Let me be clear about expectations. This is a supportive habit. Most men who try it report subtle changes in sensation and confidence in 2-4 weeks. Hardness may improve more slowly. Sensation and morning firmness often come first. If nothing changes after a few weeks, see a urologist. This technique helps some men. It won't fix every cause of erectile difficulty, but it's a low effort, low cost first step you can take tonight. Real men use this. John, 67, told his doctor he was tired of soft mornings. He tried the oil rub daily for 3 weeks. He said mornings felt firmer and his confidence returned a bit. He kept his physician involved and stayed on his prescribed meds. Another man used the rub after prostate treatment. He said the local massage reduced numbness and helped his pelvic rehab feel faster. These are not miracles. They are real reports from men trying a small, consistent habit. What you are doing with this 60-second ritual is simple. You warm tissue. You increase local blood flow. You stimulate tiny nerves. You help the body make more of its own nitric oxide. You pair touch with calm breathing to shift the nervous system toward relaxation. It's small work. It's easy to repeat. And it's something you can control. If you try this, be mindful and safe. Check with your doctor when needed. Use a patch test if your skin is sensitive. Avoid latex condoms after applying oil. If you feel pain or see redness, stop and get checked. This is one single solution you can add tonight. A tiny, repeatable habit that fits into your life. No pills to buy, no machines to learn. Just a teaspoon, a minute, and a gentle hand. Just a teaspoon, a minute, and a gentle hand. Try it tonight. You don't need to believe it will fix everything. You only need to try it consistently for a few weeks. Here's a simple nightly routine that many men find easy to stick with. Wash your hands first. Sit or lie down in a comfortable spot. Scoop a teaspoon of extra virgin olive oil. Warm it in your palms until it feels slightly warm. Not hot, just warm. Use light pressure. Place 2 fingers on the perineum, that small area between the scrotum and the anus. Make slow, soft circles for 30 seconds clockwise. Keep your breathing steady. Inhale for 4 counts. Exhale for 6. After 30 seconds, switch to counterclockwise for 30 seconds. Finish with gentle strokes at the base of the penis for a few seconds. That's your full minute. If you like, do this after a warm shower. Heat helps the vessels open. A shower makes the tissue more responsive. But you can also do it before bed. Make it a tiny ritual. Consistency matters more than timing. A few small tips that make a big difference. Use only a small amount of oil. Too much can feel messy. Don't use oil with latex condoms. If your skin is sensitive, test a pea-sized patch on your forearm first. Stop immediately if you feel pain, burning, or if you see redness. If you have open sores or an active infection, wait and see your doctor. You might be wondering how fast you should expect change. Most men report small shifts in sensation in 2 to 4 weeks. Morning firmness or a bit more sensitivity often comes first. Hardness can take longer. Give it 6 weeks of daily practice before you decide it's not helping. If nothing changes by then, book an appointment with a urologist. This isn't magic. Think of it like oiling an old door hinge. The hinge doesn't turn perfectly after years of rust. A little oil and a few turns can make it swing more freely. The same idea applies here. Warmth and gentle motion help tiny blood vessels relax. That can improve flow and nerve signaling. Over time, repeated gentle work may help the area respond better when you want it to. You don't have to do this alone. Talk with your doctor about it. One urologist I spoke with, Dr. Alan Harris, told me he encourages patients to try simple local care alongside medical therapy. He said it's low risk and often helps men feel proactive. A pelvic floor physiotherapist I know also uses targeted stimulation in rehab programs after prostate surgery. They don't promise miracles. They use it as a supporting tool. Pairing this oil ritual with a few other habits can speed progress. Try a short walk most days. Aerobic activity helps overall blood flow. Cut back on heavy alcohol. Limit smoking. Manage blood pressure and blood sugar. Studies suggest small lifestyle changes plus local pelvic work produce better results than either alone. And if you can, add simple pelvic floor exercises. Think of slow, gentle squeezes of the muscles you would use to stop urine. Hold for a few seconds. Repeat 10 times. Do this once or twice a day. Many men report that pelvic floor training and the oil ritual work well together. Keep a simple log. Write the date and one short note each morning. Note morning firmness on a scale of 1 to 10. Note whether sensation feels different. Track mood and confidence too. You might be surprised at how much confidence can shift with small physical changes. Seeing progress on paper can keep you motivated. A few practical answers to questions men often ask. Is it safe with medications? If you take nitrates or have unstable heart disease, talk to your doctor first. If you had recent prostate surgery, ask your surgeon before trying local massage. Is it messy? Use a towel and a small amount of oil. Wash sheets if needed. Do you need special equipment? No, just a teaspoon and clean hands. Let me share 2 short, real stories. John, 67, tried this after months of soft mornings. He tried it every night for 3 weeks. He told his doctor about it and stayed on his meds. He noticed mornings felt firmer and his confidence slowly returned. He called it a little ritual that started to change how I felt about myself. Another man, Frank, 72, used the rub as part of his pelvic rehab after prostate treatment. He said numbness decreased and muscle awareness improved. Both men kept their doctors involved. Neither expected instant miracles. Both saw small, meaningful shifts. What to watch for? If you feel new pain, sharp sensations, or see unusual redness or swelling, stop and call your doctor. If you develop discharge or a fever, seek care right away. Those signs could indicate infection or another problem. If you're on multiple medications for heart disease, ask your cardiologist if this is right for you. Safety first. This 1-minute habit is also about control. Erectile changes can make a man feel helpless. Doing something small and consistent fights that feeling. It gives you an action you control. That alone can lift mood and reduce anxiety. And reduced anxiety helps blood flow. It's a positive loop. Now for the practical checklist you can screenshot or write down. Wash hands. Warm 1 teaspoon of extra virgin olive oil in your palms. Sit or lie comfortably. Place 2 fingers on the perineum. Do slow circles for 30 seconds clockwise, then 30 seconds counterclockwise. Finish with gentle strokes at the base of the penis for a few seconds. Breathe in for 4. Breathe out for 6. Repeat nightly for 6 weeks. Track morning firmness and confidence. Before I close, one final thought. This minute is not a cure-all. It's a low-cost, low-risk nudge toward better local health. Many men find it lifts sensation and confidence. Some report firmer mornings in days or weeks. Studies and pelvic health clinics support the idea that targeted local care can help. But if you don't see change or if symptoms worsen, see a specialist. There are effective medical options available, and early evaluation can reveal treatable causes. If you try this, tell us what happens. Leave a short comment about your week 1 or week 4 results. If you have a question for your doctor, print the checklist and bring it to your appointment. In the next video, I'll reveal a second tiny tweak you can add to this ritual. It takes 90 seconds, and many men say it doubled the benefit in their first month. I'll also show a quick 2-minute home test that helps you know if you need to see a urologist. Don't miss it. If this helped you feel a little less stuck, hit subscribe. Share this with a friend who needs a simple place to start. Try it tonight. 1 teaspoon, 60 seconds. Small action, big dignity.